Back in the late 70s, hospice was becoming more well-known here in the States, having started in England, and some people in the community decided to get together and try to start a program here in Cape Cod.
There was a need in the community that was not being filled by any other organization or medical profession or outreach group, that hospice was the right thing to do and it wasn't being done.
We had volunteers in the office, we did volunteer training, and finally we hired another nurse part-time, and then it just kind of grew from there.
It was a great place to work right from the beginning. I felt very welcome the minute I walked in the door, and it was a great bunch of people to work with.
We all had a good understanding of each other's roles, and I think the families benefited tremendously from that.
The early years were very different from what they are now in many ways. I mean, the care at the bedside is still the same.
I remember chipping the ice off a payphone to return a call page, back when we had beepers.
Of course, we didn't have computers, so all of our documentation was on paper, and of course the paper documentation changed over the years, but it was on paper for many years.
The big joke in my household was that my 6-year-old son thought everybody carried a commode in their minivan to deliver to families, because we were our own DME transport company too.
We're very proud of our tradition here at Hospice and Palliative Care of Cape Cod. This organization is really truly one of the pioneering hospice programs in the country, and it's one of the ones that started a movement of volunteers and a few individuals many years ago, and has now evolved into a significant and integral part of our entire healthcare system.
Over the years, with community support, we've added wonderful programs like Kids Grieve 2. We opened a hospice residence in Barnstable. We've expanded our grief programs and our outreach to everybody, our incident programs. We have opened McCarthy Care Center in Sandwich. We are now growing and providing care to a larger community.
There's a lot of links to our past that are the same for our future, which would be that we reach everybody, that nobody die without the care and support that we can offer.
We now employ over 200 staff and a comparable number of volunteers delivering our exceptional care to patients and families every day of the year. We also benefit and have over the years from the support of many, many donors, and we're so thankful for what that has made possible.
This organization started small and grew from Mary McCarthy to Marilyn Hannes to David Ream, who is now taking us to the latest chapter of this organization.
It's wonderful to see the progression of the organization over the last several years and the increase in the level of professionalism and business savvy and the programs and offerings that hospice has to offer both its clients and the community.
It has an incredible tradition of providing high quality, compassionate, professional healthcare services to people in the final stages of their life. The organization draws on that tradition as it looks to expand services available to a broader population in a wider geographic area. So, rooted in and grounded in that tradition, Hospice and Palliative Care of Cape Cod looks to a tomorrow as bright as it's yesterday.
People always ask me how I can keep doing this work and how it doesn't affect me, and my answer is always the same: it's the amazing people you meet along the way. The patients, the caregivers, it's an amazing thing to be able to do it.
I've learned a lot over the years about people, because I've gotten into a lot of people's homes, and I've seen a lot of people at very, very bad times, and everybody's different. But I think that they always want to reach out for somebody to be there, even if they don't know you. There are times when you feel like you're really doing somebody good by being there.
It's truly a privilege to be part of people's lives at such an intimate time in their journey. And not only did we care for the patients, but more importantly, we empowered the families to be able to give the best that they could to their loved one.
What we're really about is living. We're helping people in their journey of life, and to help them live as well as they possibly can with whatever time they have left.
celebrate life. Happy 30th anniversary, Hospice and Palliative Care of Cape Cod.
Happy 30th!
Happy anniversary.
Many, many more.
Happy anniversary, Hospice and Palliative Care of Cape Cod.
Happy anniversary.
You are tops, and we want you to remain that way.
Happy 30th anniversary, Hospice and Palliative Care of Cape Cod.
And many more years to come.
Happy 30th anniversary.
May you continue for at least 30 more years with the good care that you've always provided.
Happy 30th anniversary, Hospice and Palliative Care.